Hi everyone, in this video we are going to discuss how to naturally reduce the size of your prostate gland without using medication or undergoing surgery. The prostate gland sits below the bladder and surrounds the urethra. When it enlarges, it begins to press over the bladder and the urethra walls. Now, this can lead to noticeable symptoms, especially in men over 50. An example is feeling the urge to urinate even when the bladder isn't full. Changes in male sex hormones that occur naturally with aging play a major role in prostate enlargement. You might be wondering why this happens, right? You need to know that men have about 50% chance of developing BPH. BPH means benign prostatic hyperplasia, that is by the age of 60. Now this probability rises to around 90% by the age of 85. That means that BPH can affect you or anyone else as they get older. Now androgens such as testosterone influence prostate growth. And the prostate converts testosterone into DHT. That is another powerful androgen. Now, DHT promotes the growth of prostate cells and prevents those cells from dying. Estrogen, which is also present in men, may also play an important role in prostate enlargement. As men age, testosterone levels drop while estrogen levels rise. Now, this hormonal shift can actually stimulate prostate growth. Next, let us look at the risk factors for an enlarged prostate. The first risk factor is aging. Now, the risk of getting prostate increases as men get older. BPH is uncommon before age 40, but becomes increasingly common after age 50. Now, the second risk factor is family history. Having a father or a brother with BPH increases the likelihood of getting it. Our next risk factor is obesity. Excess body fats can disrupt hormone balance, lowering testosterone levels and increasing estrogen, which may contribute to prostate enlargement. Another risk factor is lack of physical activity. Now, sedentary lifestyle is linked to higher risk. Regular exercises can lower the likelihood of a person getting BPH. Our next risk factor is hormonal changes. Aging causes testosterone levels to drop and estrogen levels to rise. This can stimulate prostate growth. Another risk factor is medical conditions. Certain conditions can increase the risk. For example, type 2 diabetes, heart disease, and metabolic syndrome. Now, the seventh risk factor is erectile dysfunction. Men with erectile dysfunction have got a higher likelihood of developing symptoms of BPH. Now, in the previous video, I shared symptoms of an enlarged prostate. These ones include incomplete bladder emptying, frequent urination at night, that is nocturia, urinary incontinence, straining to urinate, weak urine stream, sudden strong urge to urinate, slowed or delayed urine flow, and painful urination. Now, if you like this video, you can go and watch it. What can you do to reduce an enlarged prostate? Now, improving prostate health involves dietary changes, supplements, and lifestyle adjustments. So the first habit is to adopt a prostate-friendly diet. Eating a balanced heart-healthy diet can help reduce inflammation and also help to balance hormones. These two factors are both important for your prostate. Now, the first group of foods that we are going to focus on is fruits and vegetables. Aim for 5 servings in a day, especially those ones that are rich in antioxidants. Now, lycopene found in cooked tomatoes and sulforaphane found in vegetables such as broccoli and cauliflower are thought to be particularly beneficial. Another group of food that you need to focus on is healthy fats. Aim for omega-3 fatty acids that are found in fish such as salmon and sardines. In addition, you can also get healthy fats from nuts and seeds. You need to limit saturated fats that are found in red meat and some dairy products. Another important habit that you are supposed to do that has something to do with foods is to reduce the processed foods. Now, in this process, you are supposed to cut back on sugary drinks, packaged snacks, and also processed meats, which can easily contribute to inflammation. Now, the second important habit for you to do is to get on regular exercises. Physical activities can help us to maintain healthy weight. This may help to reduce on inflammation and also maintain on hormone regulation. All this may help to contribute to better prostate health. It is also important for you to maintain aerobic exercises. Now, it is important for you to try at least 150 moderate to intensity exercises, which should be done per week. Now, these exercises can be brisk walking, swimming, or cycling. Now, you can also incorporate Kegel exercises. Kegel exercises help us to strengthen pelvic floor muscles. Now, this can help us to manage bladder control and also get regular exercises while trying to move. Now, this can help us to improve on bladder control in addition to management of urinary symptoms. We all know that these symptoms are actually common with enlarged prostate, that is BPH. Another very important regular exercise that you need to maintain is to manage fluid intake. Now, adjusting when and what to drink may help to manage urinary symptoms which normally come with BPH. You need to restrict the amount of fluids that you take before bed, that is 1 hour or 2 hours before bed. This will help you to control the amount of times that you wake up at night to urinate. Now, you can also reduce bladder irritants. Caffeine and alcohol can increase urine production, which can actually irritate the bladder. Now, you also need to stay hydrated during the day. Proper hydration is still essential. Be sure of drinking plenty of water during the day. You can also practice smart bathroom habits. Changing your urinary routine can help to ensure more complete emptying of the bladder, which can alleviate symptoms and prevent further complications. Now, you can also practice double voiding. After urinating, try to wait for a few minutes, then you try to urinate again. This can help to ensure that your bladder is fully empty. You can also go to urinate when you first feel the urge to do so. You are not supposed to hold your urine for too long. Now, you need to know that this can actually lead to overstretching and damaging of the bladder muscles. Now, our next strategy is we are going to use supplements for prostate health. I have discussed in a previous video about supplements, but that was just an overview. Now, let us look at the supplements in details. Now, supplements can be useful, but should be used along with a healthy diet. Reduce sugar intake and accompanied by exercise. So, this exercise should be regular. Another thing for you to note about supplements is that supplements are not a replacement to medical treatments. Now, let's begin by looking at one of the supplements, which is green tea. Now, green tea is a strong anti-inflammatory substance that contains antioxidants, which can help to reduce strain on the prostate. Our next supplement is zinc. Zinc plays an important role in lowering estrogen levels. As men age, estrogen level increases while that of zinc decreases. Now, supplementing with zinc can help to prevent zinc deficiency, lower DHT production, and reduce DHT binding to receptors. Now, this may help improve on enlarged prostate symptoms. Our next supplement is gonna be sopalmeto. A systemic review of multiple clinical trials involving over 6,000 men found that sopalmeto improved prostate health. Now, sopalmeto works by inhibiting an enzyme known as 5-alpha reductase. Now, this enzyme plays a role of converting testosterone into DHT is a hormone that enlarges our prostate. Sopalmeto works by preventing DHT from binding to androgen receptors. This reduces growth signals in the prostate tissue. Now, our next supplement is cranberry. Cranberry supplements, and not a whole fruit, are beneficial for urinary and prostate health. Cranberries contain oligosaccharides and phytochemicals such as proanthocyanidins and flavonoids. A clinical study using 250 to 500 milligrams of full-spectrum cranberry fruit powder showed dose-dependent improvements in men over 45. Another supplement that we can use is Epsom salt bath. Epsom salt baths can help to reduce muscle aches, improve comfort, promote better sleep, and also support prostate health. Add 1 cup of Epsom salt to warm water. Soak for 15 to 20 minutes before bathing. This may help to reduce symptoms of benign prostatic hyperplasia, aka BPH. Do not forget to like, share, and also subscribe. You may also like the next video.